Hello friends, today we are going to see about the second part of antihyperlipidemic drug, which is also called as hypolipidemic drug or agent or cholesterol lowering drugs. So in the second part we are going to cover classification of hyperlipoproteinemia, classification and characteristics of major plasma lipoproteins, and classification of antihyperlipidemic drugs. In the first part we have covered introduction, biosynthesis of cholesterol and degradation pathway of cholesterol. So to start with the classification of hyperlipoproteinemia. So what is hyperlipoproteinemia? It is increase in cholesterol level in the blood. This hyperlipoproteinemia is divided into two parts. First is the primary and secondary disorder. So in the primary disorder, this is the result of genetic deficiency or malnutrition. This can be also happen due to the dietary habit or physical related activities. Uh, this is the disease condition, and here the second part, secondary hyperlipoproteinemia, has been associated with diabetes mellitus, hyperthyroidism, renal disease, liver disease, alcoholism, and certain drugs. It is also associated with the nephrotic syndrome, chronic alcoholism due to it, or due to the diabetes also. So here the primary and secondary disorders can be the reason for the hyperlipoproteinemias. Now, what are the sources for cholesterol in our body? So we are getting by two sources. First is by using liver and other cells of the body, it produces cholesterol in our body, or by eating the food containing cholesterol, our body synthesizes cholesterol, and this cholesterol from both sources can deposit in the blood vessel and form plaques. So this can be the reason for the cholesterol deposition in our body. Now, different types of cholesterol or lipoproteins are there in our body, such as chylomicrons, chylomicron remnants, VLDL, IDL, LDL, and HDL. So we are going to see in detail about all this. Chylomicrons, this is composed of triglyceride, free cholesterol, cholesterol esters, phospholipids, or apoprotein. This is used to transport dietary triglycerides to adipose tissue and muscle for hydrolysis by lipoprotein. Second is the chylomicron remnants. It is composed of dietary cholesterol esters. This is used to transport dietary cholesterol to liver for receptor mediate endocytosis. The next is VLDL. VLDL, it is composed of triglyceride, free cholesterol, cholesterol ester, phospholipid, apoproteins. This primary function of this is to transport endogenous triglyceride to adipose tissue and muscle for hydrolysis of lipoprotein lipase. Then next is IDL. IDL is intermediate density lipoprotein, and VLDL was very low density lipoprotein. So in the IDL, that is intermediate density lipoprotein, it is composed of, or it is intermediate of, VLDL and LDL. It is used to transport endogenous cholesterol for either conversion to LDL or receptor mediate endocytosis by the liver. Next is LDL. LDL is the low density lipoprotein. It is composed of triglyceride, free cholesterol, cholesterol ester, phospholipid, and apoprotein used to transport endogenous cholesterol for receptor mediate endocytosis by either liver or extrahepatic tissues. And last is high density lipoprotein. It is also composed of same components such as triglyceride, free cholesterol, cholesterol ester, phospholipid and apoprotein, and used for removal of cholesterol from extrahepatic tissues via transfer of cholesterol esters to the ideal and LDL. So in our body all these lipoproteins are present, where HDL are considered as good cholesterol and LDL or VLDL are considered as bad cholesterol, which is responsible for deposition of plaque in the blood vessels. Now to reduce this plaque or to reduce the cholesterol in our body, antihyperlipidemic drugs are available in the market, and this antihyperlipidemic drugs are classified into the 5 sections. This is the very important classification. So first is HMG-CoA reductase inhibitors. So in this HMG-CoA reductase inhibitors, examples are statins such as lovastatin, pravastatin, simvastatin, atorvastatin. These are the very important classification, and in our syllabus mostly statins are asked for the study. Then fibric acid derivative, in this clofibrate and fenofibrate, bile acid resins, cholestyramine and cholestyramine are the drugs to lower the bile acid resin. Then nicotinic acid, this is the fourth classification, and cholesterol absorption inhibitors. Cholesterol absorption inhibitors, in this example is ezetimibe. Drugs that lower the serum lipoprotein concentration. Antihyperlipidemic drugs target the problem of elevated serum lipids with complementary strategies. Some agents decrease production of lipoprotein carrier of cholesterol and triglyceride, whereas other increases the degradation of lipoprotein. Still, others decrease cholesterol absorption or directly increase cholesterol removal from the body. These drugs may be used singly or in combination. However, they are always accompanied by the requirement that dietary saturated and trans fats below and the caloric content of diet must be closely monitored. Then different types of HMG-CoA reductase inhibitors are there. This we are going to see specially in our lectures because these are specially asked in the syllabus. So HMG-CoA reductase inhibitors are the statins drugs. So the statins are the most effective and best tolerated agents for treating hyperlipidemia. These drugs are competitive inhibitors of HMG-CoA reductase enzyme, which catalyzes an early rate limiting step in cholesterol biosynthesis. How the statins were discovered? The statins were discovered by isolation of mold such as Penicillium citrinum and identified as inhibitor of cholesterol biosynthesis in 1976 by Endo and colleagues. The first statin studied in human was compactin renamed as mevastatin, which demonstrated the therapeutic potential of the statin. Now, what is exactly statins? Statins are hypolipidemic drugs which decreases the cholesterol level in the body by blocking the enzyme HMG-CoA reductase, which is required for the synthesis of cholesterol. We have seen the cholesterol synthesis cycle, and in that first second step is the conversion of acetyl-CoA into the mevalonic acid. So in this it requires the HMG-CoA reductase enzyme. So this antihyperlipidemic drug competitively inhibit the HMG-CoA and decrease the cholesterol level in our body. Examples of such drugs or such statins are simvastatin, pravastatin, lovastatin, etc. Statins are generally quite safe drugs, but side effect may be muscle pain or fatigue. So these are about the some classification, and now we are going to see the third part in which we are going to cover the many more sections of the anti-hyperlipidemic drugs. Thank you.